I was asked to share my experience living with ADPKD at the Vancouver Forum, PKD Forum, run by Dr. Bevilacqua.
Working with Phaydy is great. I still remember I met her at an event we had. We had this event where we were doing an education evening about polycystic disease that was open to the public.
I'm scared of speaking in public and that these people, I don't know, that I have to go and tell about myself. And then at the end I decided, okay, I would do it. Later on I was asked to volunteer in the advisory committee group.
Yeah, it's just been so valuable having her on. She is one of these people who will always speak her mind, and as I alluded to earlier, is very good at gently telling us, when maybe we're heading into the weeds a little bit and bringing it back to, as a patient living with the disease, this is what I want to know. As a person who goes through this is what I want to know.
Every meeting, they always send the agenda so that you can preview ahead of time, so I know what I can share, what my experience, what kind of question to ask or to share.
I think having a patient voice at the table every time we're in our steering groups or our planning committees is very important, because they'll often both come up with new ideas that we may not have thought of, because our perspective as healthcare providers is very different from the provider of someone living with a disease. So they'll come up with new ideas, but also they'll sometimes challenge us on what we're thinking, on assumptions we might have. Sometimes we have a habit of thinking we know best as care providers, what a patient might need, and it's healthy and good for us to be challenged on that every now and again.
Maybe the professional, but they're not the one that living with it. So we are the one that living with it, and we know what it's like. So we like to see they find a way to treat it.
We've developed a whole host of different resources out there to really enable care providers to care for patients with polycystic disease. So there's all these various handouts and tools and teaching tools for clinicians. And to go along with those, we made a very strong effort to have whatever we have a staff or clinician guide for, we have an analogous patient-facing one. This was one of the suggestions from our patient team, but even more so than just doing that, the fact that we can actually say all of our patient resources aren't just intended for patients, but developed by patients is a huge thing.
We just build resources regarding blood pressure monitoring or pain management and things like that at the resorts, and go have a look, and also tell more people to look at the resource so that it's spread. People can share, right, when they know more.
We've always talked about patient-centered care, but it was always developed by clinicians for clinicians, to be perfectly frank. Our system's set up because they work for us, they work for our hospitals, they work for efficiency, and we can get things through. But to truly say that we've designed something with our patients in mind, they absolutely need to be right in that planning process. And that whole concept, I think, is revolutionary and really has shifted the way we think about medicine.
It's hard living with this disease, and I'm so glad that there's so many research and help, like the BC Renal is doing so much to find out way to help patients.